UNICEF staff in Mogadishu, Somalia's capital, are constantly on the move. Maulid Warfa, UNICEF's emergency specialist, is on his way to see a new group of internally displaced persons, or IDPs, who've arrived in one of Mogadishu's many camps. Majo camp was set up last August to provide shelter for those desperate to escape the famine and drought. The flimsy shelters, made of plastic, give little protection against the overnight rains. But those in the camp say they're better off here.
The situation was bad before we came here, but our life has changed a little bit. At least we get some food and water. This way, we have managed to survive the hardships, but now we don't have enough water in the camp. This is the biggest problem.
These experiences are familiar to Maulid. His family fled fighting in Ethiopia when he was just 9 years old, and he grew up in a refugee camp in southern Somalia. It's from this childhood experience that he draws his passion for helping others.
I actually literally live in a little tukul, exactly close to what people are living now here in the IDP camp. So when I come to the field, and I talk to the children and I talk to the mothers, it reminds me of my childhood life. It reminds me of how difficult it is to live in a camp, how difficult it is to come out without food.
UNICEF is helping to provide services for the IDP children at the camp. Along with partners, it's established 6 schools, all housed in tents, where the children attend lessons in shifts in the morning and afternoon. 9-year-old Fartoon Mohammed Hassan, who recently came from a town west of Mogadishu, leads the class through their numbers.
There was heavy fighting in Elisha. That's why we came here. I attend this school every day. I learn many subjects like science, Arabic, Somali and mathematics.
The school may appear basic, with few facilities, but for many of these children, it's their first opportunity to go to class. And there isn't room for all those who want to come.
From this area to that area, and 6 schools are not enough, according to the peoples are living here, and the schools are constructed here are not matching each other. That's a big challenge also. So it's good to expand for at least 10 or 15 other schools.
Next, Maulid travels to the other side of Mogadishu to visit a busy centre, bringing together nutritional care for malnourished children along with health facilities.
UNICEF is running hundreds of these centers, and since July last year, once the famine had been declared, UNICEF and the partners, more than 76 of them, had reached more than 413,000 malnourished children, half of them severely malnourished and half of them moderately malnourished.
Many of those queuing here are among the 1.3 million IDPs who've left their homes, nearly 2/3 of whom are children. They're among the most vulnerable in Somalia, with little or no means of support. 5 months ago, Habibo Abdi brought her 3 children who were severely malnourished to this centre for help.
My baby's condition has really improved. He's now better. The rest of my children, when we came here from Elisha, their conditions were very bad. But since they were put on feeding programs, they have really improved.
Finally, Maulid makes a stop at Hanano Medical Centre in the city's Hodan district. This centre deals with all aspects of mother and child health, and UNICEF provides medical supplies and equipment. Young mother Nadifo has brought 7-month-old Maida Mohammed for vaccinations. 4 days ago, her family and others were evicted from their temporary shelter and came to an IDP camp near the airport. Despite having to find a new home, she still turned up to immunize her baby.
I brought my child here to be vaccinated because I know immunization protects children from catching diseases. My firstborn son died of measles. He was not immunized. We did not know these things.
Children under 5 are vaccinated against measles, polio, diphtheria and whooping cough and given vitamin A supplements. And the team goes to great lengths to reach those outside the city. Somalia's immunization rates are among the lowest in the world. But even at the peak of the crisis, Unicef continued to provide essential coverage, vaccinating more than 1.5 million children against measles since last July. Such immunizations, coupled with other health, water, education and nutrition services, have over the past year provided millions of children with a package of critical care. This is Susanna.